factors, our lifestyle, our say how to approach our routine daily activities. So this has all been contributing to our obesity and other non-communicable diseases. Rising pollution is now contributing to diseases like COPD, respiratory illnesses. So addressing these problems is a major concern for all of us, especially in the ministry. It becomes our responsibility to make you all aware, our healthcare professionals, about this disease and its possible prevention. So the ministry has initiated this series of webinars where we try to educate our health care workers, our doctors, our nursing staff, our paramedical staff, try to educate about these various non-communicable diseases and the ways where we can prevent this. So we already have done 3 or 4 seminars, webinars for prevention of these non-communicable diseases, which include prevention of breast cancer, cervical carcinomas. A webinar was done on the chronic respiratory diseases, obesity. So this webinar is now on how to achieve a healthy lifestyle by especially increasing our physical activity, by engaging ourselves rather than just engaging in the studies and the work. How can we make our life more fit? And to address this, we have Mr. Sandeep Rana, sir, who is an IRS and he's the director Fit India, Sports Authority of India, with us, who will be enlightening us on this particular topic. Dr. L. Swastichan, who has been the backbone of this webinar series and of the National Non-Communicable Diseases Division. So, sir is busy right now in another meeting. So, I will be requesting Mr. Sandeep Rana, sir, to please go ahead with the presentation and enlighten our participants who are medical officers, who are nursing staffs, who are paramedicals, who actually deal with the population at large. And by your wisdom, probably they will be able to enlighten our population more regarding the fitness. Sir, please. Thank you, sir.
So much, sir. I hope my screen is visible.
Yes, sir.
Okay. Respected senior officers and officials of NCD Division, DGHS, and participants of the webinar, a very good afternoon to all of you. First of all, I take this opportunity to thank National NCD Division, DGHS, for giving Fit India Division an opportunity, a platform for raising awareness about Fit India movement. So this movement that aims for lifestyle modifications, which includes mainly physical activities, and the same goes a long way in prevention and control of non-communicable disease. And therefore, we encourage everyone to follow fitness ki dose Aadha Ghanta Roz, which means that at least 30 minutes of physical activity, it has to be introduced in the lifestyle. So first of all, why this session is important? Fit India movement, session on Fit India movement, why this is important? The non-communicable disease, as we all know, that they may occur due to lifestyle as well as genetic factors. And therefore, some of them are also termed as lifestyle disease. The risk factors for NCD, they are mostly poor diet, lack of exercise, sedentary lifestyle, inadequate sleep, smoking, and alcohol consumption, and stress also. And if we see that people of all ages, gender, and region, they are prone to these risk factors. Then the behavioral factors are there, but good part is that behavioral factors are modifiable with proper lifestyle changes and physical activities. And Fit India movement focus aligns with National Program for Prevention and Control of Non-Communicable Disease Strategy, which is by encouraging physical activity and lifestyle changes. And therefore, as we say, prevention is better than cure. So this strategy is followed at Fit India movement. If we talk about behavioral factors, risk factors, tobacco use, smoking and smokeless tobacco usage, then alcohol uses, then unhealthy diet, physical inactivity, pollution is also one of the factors. And the behavioral factors, those lead to physiological risk factors as they arise because of the behavioral factors like overweight, obesity, raised blood pressure, raised blood sugar, raised total cholesterol, oblique lipids. Then disease outcomes. If we see that behavioral risk factors and physiological risk factors, they lead to various diseases, which are mainly cardiovascular disease, cancer, chronic respiratory disease, diabetes, then COPD and asthma, stroke, and non-alcoholic fatty liver disease. And there is one study that while we were preparing PPT for this session, we found that there is a study also which has been done by National Center for Disease Informatics and Research, Bengaluru, which talks about prevalence of risk factors associated with NCD among adults 18 to 69 years in India. And then they found that tobacco usage, it results in risk factor of 32.8%, alcohol use almost 16%, inadequate intake of fruits or vegetables 98.4%, and insufficient physical activity, it leads to risk factor of 41%. Now talking about Fit India Mission, this was launched by Honorable Prime Minister Shri Narendra Modi ji on 29th of August 2019, which is also 29th of August is also our National Sports Day. The objectives that are of this Fit India Mission, one is bringing about behavioral changes and promoting a more physical activity and through that physically active lifestyle also. Then Fit India Mission also aims for that we promote fitness as easy, enjoyable and cost-free. Like whatever is convenient to any citizen of this country, be it of any age group. So we promote that fitness should be enjoyable and cost-free, and therefore fitness can be ensured in different ways. Then raising awareness about fitness and various physical activities that promote fitness through focused campaigns. We would be talking about these campaigns. Then we encourage indigenous sports also. It is not necessary that one should go for competitive sports only. There are various local and indigenous sports, which is like Gatka is there, then Malkhambh is there, Yogasana is there, and Thangta is also there. Then we want to ensure that fitness reaches every school, college, university, panchayat, village, mohalla. And then the citizens, as I talked about earlier, they are encouraged to include at least 30 minutes of physical activity in their lifestyle. Creating a platform for all citizens of India to share information, drive awareness, and encourage the sharing of personal fitness story. We have our Fit India mobile application, which I would be talking in the next slide. And then we want that this turn into a people's movement with government being a catalyst. If we talk about key initiatives and activities, those are through citizen engagement, and that is done through age-appropriate fitness protocol that I would be discussing in next slide. Then Fit India mobile app is there, and Fit India icons and influencers. Those people who have good number of followers on social media and they are promoting fitness, we have incorporated in our Fit India movement as Fit India Prerak, icon and influencers. Then there are events and campaigns which include National Sports Day celebrated on 29th of August every year. Then Fit India Cyclothon, Fit India Freedom Run, and then school activation, because schools is the early stage where we can inculcate this Fit India movement and Fit India initiatives in the children in the beginning itself. So this is promoted through Fit India Quiz and Fit India Week, as well as National Sports Day. So talking about age-appropriate fitness assessment, there was an expert committee which was constituted under chairmanship of Dr. K.K. Deepak, Professor and Head of Department Physiology, AIIMS, New Delhi. And the purpose of committee was for development of fitness protocols for different age groups to promote physical activity based on individual needs. So this age-specific fitness protocols are basically for three categories. One is 5 to 18 years, which emphasizes physical education in schools and activities like yoga, dance, and sports to instill lifelong healthy habits, and also encourages muscle strengthening activities. Then 18 to 65 years, which is primarily adult category. So 30 to 60 minutes of moderate to vigorous physical activity per day, which include a combination of flexibility, strength, endurance exercises, and yoga to maintain cardiovascular and muscular health. Then 65 plus years, senior citizens, these protocols focus on flexibility, strength, agility, and balance exercises to prevent falls and improve functional capacity, particularly important for NCD prevention in older adults. We have attached PDF also, which you may refer, and where these protocols, they have been discussed in detail. And these protocols, they have been divided into test description, then fitness protocols, age appropriate yoga protocols, safety consideration while doing various activities, and then benchmarking for fitness test. Talking about Fit India mobile application. So Fit India mobile application, this can be downloaded on all the platforms. Then it standardizes fitness assessment based on age group that I talked earlier. And there is single sign-on capability. With Google, it can be signed in also. Then here we can track steps, sleep, cycling, and running. Customized diet plans are also available there. Recently, we have translated, earlier it was only in English and Hindi. We have translated it into 12 languages, and we are trying for translating into more languages. And then user interface is there, which has been upgraded from time to time. And especially there are videos for right way to perform physical activities. So talking about advantages of FIMA Fit India mobile application. So by downloading this, it would help in adopting regular exercise, reducing
Sandeep sir, are we audible to you? I think Sandeep sir has a bandwidth issue right now.
Yes,
Participant, please wait for a few minutes. He will be joining in soon.
Yeah, I think till the Mr. Sandeep joins back, so we can have just a little chat with a little interaction with the participants, in the sense that what Sir was telling is quite appropriate. And if we look at the app which he has mentioned, is the Fit India mobile application. So it's a very useful app, which if I can see in my mobile, if by the time Sir joins, even we can download this app in our mobiles, and it's all showing that how many steps we have taken in a day. If we are running or cycling, it will give you an idea of how much activity you have done. So instead of googling on the other apps where we are not very sure that whether they are authentic or not, whether they will give the right thing, so this is a government app. So rather, I was also not aware, and I'm very happy that by this webinar, I have come to know about this FIMA app. And so this is one way by which we can actually monitor our activities. Yeah. So someone is coordinating with Sandeep sir?
Yes, sir, have spoken to him. He'll be joining.
Right. So what Sandeep sir was telling was that it is our behavior actually. Like in the, if some of you, the participants, might have joined the obesity webinar also, in which I spoke about the behavior and the eating habits. So certainly it is not that if we want to improve, so the improvement has to be first that we have to take a decision that we want to certainly improve on a certain aspect. So Sandeep sir is there, so we will get back after this for this discussion once sir finish. Yeah.
Yes, Manjit, would you like to add anything? Okay. Sir, please continue with your presentation.
Yes. As I was talking about advantages of downloading this Fit India mobile application, there are fitness tests, there are meal plans that are provided on this mobile application. Then BMI calculator is there, and there are trackers for sleep, water, and steps. And this regular exercises can be adopted, screen time would be reduced, and this diet plans, as I already stated. Then there are expert articles and fitness blogs on fitness, wellness, and lifestyle changes. And these blogs cover topics like disease prevention, workout routine, mental health. Then this app, like it can be utilized to log our running, cycling, and walking activities. Then share our fitness tracking results. And even challenge option is also there, where you can challenge your family members or your friends and motivate others to stay active. Talking about our campaigns that we run every year, one of the main campaign is National Sports Day. National Sports Day is celebrated every year on 29th of August, and it is tribute to our hockey legend Major Dhyanchand's birthday. Then all Sai regional centers, our sports training centers, ministries, government departments, universities, schools, NGOs, corporate groups, and all organizations, they are like encouraged to participate in various events, including sport competitions, indigenous games, outdoor, indoor, and fun games. Then the sports, we also share one SOP where we request organizers to basically organize these events through group format instead of individual players to bring spirit of bonding, unity, and inclusiveness. Then competition in indigenous and contemporary sports, those are promoted as it serves as an inclusive way to get community involved in fitness activities. The main purpose is to ensure that sports act as a unifier, and it creates awareness for promoting fitness among all citizens. These are our suggestive activities which we share with states as well as center and other organizations. And we have bifurcated it according to age wise, and various games have been suggested. So we generally request to celebrate it in this week when this 29th August is there. And the events, they can be organized on one or more days between the decided dates. It is requested to various organizations to encourage the employees to come to office in sports attire. Then fitness place is also there. We encourage them to use locally available sports infrastructure. Then employees, they celebrate it through competitive and fun games, as I had already mentioned. Then another campaign is Fit India Cyclothon, as cycling is the easiest way to fit exercise into our daily routine. Then participants can ride bicycles either individually or as part of group as way to promote physical activity, healthy lifestyle, and community engagement. All individual and organizations, they are encouraged to take part. And this is organized by individuals, various cycling groups, educational institutions, then councils, panchayat, corporations, RWAs, NGOs, and special interest groups, then armed forces also, and police personals also. Our citizen engagement in earlier editions, in 2020, it was 35 lakhs, then 21, it is 1.2 crore. Or another major campaign is Fit India Freedom Run. Recently, we have incorporated hygiene part also in it by naming it as Fit India Swachhta Freedom Run, which starts from 1st of October to 31st of October. Last edition in 2023 was held, where participation of 4 crore individuals was ensured. And there are various benefits of running. As you all are aware, it improves heart health and aids in weight loss, boosts mental well-being, increases lung capacity, it strengthens our muscles and bones, enhances sleep quality, boosts immune function, supports joint health, improve focus and memory, and promotes longevity. So in our 4 editions, 25 crore plus participation has been ensured. Then there is Fit India Week. This is mainly for school children. This was initiated in 2019, and now in 5 years it has become a nationwide movement, igniting the spirit of fitness among school children. Various activities that are held during this period. We promote schools to conduct their annual sports day at this time. Then again, we emphasize on the indigenous games, yoga and meditation, fitness plays is there. Then fitness assessment is done through our mobile app. Fit India Parents Teacher Meet is encouraged. Then debates, essay, creative and essay writing quiz, those are conducted related to fitness and sports. In 5 editions, 15 lakh plus schools have participated, and every year this number is increasing. Then another campaign is Fit India Quiz. और इसमें there are 4 stages. First is registration on Fit India or NTA portal. तो स्कूल में पहले they promote a fitness quiz, a quiz on fitness in their school itself, and those students who are selected, they are registered on Fit India NTA portal. Then stage B is preliminary rounds. Then stage C is state rounds, and last stage is national finals. Abhi, the latest Fit India quiz that we have conducted, there was cash prize of 3.25 crores, and national rounds are about to take place. So main is that our objective through Fit India quiz is that we provide a national platform for students to showcase their knowledge about fitness and sports, and then create awareness among students about India's rich sporting history, including centuries-old indigenous sports. As questions are asked on these indigenous sports also, then our national and regional sporting heroes of the past. As I had talked earlier, this is Fit India Influencers. We collaborate with renowned personalities in the field of health and fitness, social media influencers. Their help is taken as they can reach out to maximum citizens. Those are generally popular celebrities and youth icons. And fitness and lifestyle awareness campaigns of various events are put on social media. So right now we have collaborated with more than 300 influencers. These are various partner ministries and stakeholders. Ministry of Education, जहाँ पे हमारा Fit India School Certification और Fit India School Week रहता है. Ministry of Women and Child Development, involvement of women and children in fitness and wellness activities. We are also conducting one sports league for women only, which is by name of Asmita. Then Ministry of Health and Family Welfare, as we have developed age-appropriate fitness protocols and awareness programs are done through health workers. Then Ministry of Ayush, as we are promoting yoga also as sports and common yoga protocols are there. Ministry of Housing and Urban Affairs, as we promote participation through urban local bodies and Mohalla outreach. Nehru Yuva Kendra Sangathan and volunteer groups for ensuring on-ground activities for Fit India programs. The Ministry of Information and Broadcasting for spreading awareness programs using social and print media. Then Ministry of Tribal Affairs, as we are promoting indigenous and local games. Ministry of Home Affairs to promote healthy lifestyle and awareness among citizens of India, and Ministry of Panchayati Raj. So this is all from my side related to Fit India movement. So if participants they want to ask any question related to our Fit India initiatives, they are most welcome.
Thank you very much, sir. And it was rather a very enlightening talk, and the message which you want to deliver to the participants is very much clear. And I must congratulate yourself and your Herculean efforts of the Ministry of Youth Affairs and Sports of integrating with the other ministries and, in fact, empowering our citizens of using their ability to walk to encourage the physical activities they should, and especially dividing them the activities into the particular age group so everyone can use those opportunities which are provided by yourself and your ministry. And now we can have some question and answers from sir, who is willing to take these questions if at all they are there. So do we have anything in the question and answer, Shweta ji?
So we have one question.
Yeah.
It says, will there be diet plans according to the general public demands for pre-diabetic, or uncontrolled diabetic and hypertensive conditions?
Sir, what they are, what they actually want to know is that, like in the application which you have mentioned, so probably there is a provision that we can have our diet plan. So, is there any also provision like if someone is a pre-diabetic or diabetic, that factor is also included in that, or they should have an opinion from the some doctor?
Right. See, अभी जो उसमें हमारा डाइट प्लान रहता है that is mainly according to age group, and now we are in process of improving this mobile application from time to time, and obviously we would be seeking your opinion and expert guidance also to incorporate such type of meal plans according to the non-communicable disease.
Yeah, I think the application which sir has mentioned is the Fit India mobile application. Even I was also not using, sir, and we are really very grateful to you that you have told us and made us aware. And certainly, as you were speaking, we have downloaded it. And instead of Googling and finding the applications and then using it for walk, so this is the application which is providing all that thing, that what diet, how many glasses of water we need to take, and whether we walk or.
Yes.
So this is a kind of awareness that that's needed for both.
And besides, मैं सभी participants को I would like to share कि हम लोगों में जैसे हमें इस तरह का awareness, जो एक तो हमारा फिट इंडिया मोबाइल ऐप और ये सब जो मैंने दिया है, उसके अलावा छोटी छोटी चीजें हैं, जैसे हमारा ऑफिस स्पेस है, तो वहां पर हम इस तरह का कर सकते हैं कि अगर हमारा लंबी सीटिंग है तो वी टेक शॉर्टर ब्रेक्स, हम कुछ टाइम के लिए खड़े होके काम करें या वॉक करके काम करें, उस तरह का वी शुड प्रमोट. तो छोटी छोटी चीजें हैं. मेन थिंग इज दैट जो विद इन रीच है और जो इजीली मैनेजेबल है, फिजिकल एक्टिविटी उसी तरह से हमें इंश्योर करते रहना.
जी सर, आपने बिल्कुल ठीक कहा, क्योंकि आपने पहली बार में ही यह बताया था अपनी फर्स्ट स्लाइड में कि बिहेवियर जो है वो बहुत इंपॉर्टेंट है. अगर हम अपने बिहेवियर में, अपने दिमाग में अगर ये सोचें कि हाँ हमें कुछ अपनी सेहत के लिए करना है, चाहे वो खान पान हो, चाहे वह किसी तरीके की एक्सरसाइज हो, फिजिकल मूवमेंट हो, और उसको कॉस्ट फ्री रखना है. ये नहीं कि बड़ी बड़ी मशीनें ला करके, जिम का सहारा लेकर के, वो भी एक ऑप्शंस है, पर जो शायद डेली लिविंग में जो फिजिबल है, जो आप अपने ऑफिस में बैठ करके, अपने घर में बैठ के कर सकें, तो वो भी बहुत ज्यादा कंट्रीब्यूट करता है. जी सर. तो श्वेता जी, वी कैन हैव वन मोर क्वेश्चन, एंड उसके बाद में probably we have got that email where sir can answer those questions because the time won't permit it after this. तो एक और क्वेश्चन ले लीजिए.
So one important question is, how can SNOs play a role in Fit India movement, sir? If you can explain us that.
SNOs is senior nursing officers?
No, sir. State nodal officers for
State nodal officers.
They play a role in the Fit India movement.
तो जो मैंने कैंपेन बताया, हमारा जैसे नेशनल स्पोर्ट्स डे है, तो उसमें हम जो वेरियस सेंट्रल गवर्नमेंट की मिनिस्ट्रीज हैं, वहां पर भी हमारा रिक्वेस्ट लेटर जाता है, एंड देन वी सेंड अवर रिक्वेस्ट लेटर टू स्टेट आल्सो, और उसमें हमारी नेशनल स्पोर्ट्स डे की एक्टिविटीज रहती हैं. देन मेन थिंग इज कि हमारे कैंपेन्स तो साल में आप देखेंगे तो जैसे साइक्लोथॉन एक हो गया, फ्रीडम रन एक हो गया, फिर एक हम स्कूल गोइंग चिल्ड्रंस के लिए करते हैं। लेकिन सबसे मेन है कि जो हमारा फिटनेस को हमें प्रमोट करना है, वो एक तो जो एनुअली अगर आप देखें कंटिन्यूअस है, एक तो फिट इंडिया मोबाइल ऐप है जिसके थ्रू आप ट्रैकिंग कर सकते हैं आपका कितना फिजिकल एक्टिविटी लेवल है ड्यूरिंग द डे। फिर आप अपना स्क्रीन टाइम की, हमारे मोबाइल पे भी ऐप होती है जिस पे आप जाके स्क्रीन टाइम देख सकते हैं। फिर हमारा यहाँ पर हमने ट्रैकर लगा रखे हैं जो अभी हमने जीपीएस इनेबल्ड भी कर दिया है साइकिलिंग, वॉकिंग और रनिंग के लिए। देन रिमाइंडर्स हैं जिसमें हमारा स्लीप रिमाइंडर है, वाटर इनटेक रिमाइंडर है। तो दिस इज एक कंटिन्यूअस प्रोसेस, मतलब टू बी अवेयर कि हाँ मुझे फिट रहना है। और आप कोई स्पोर्ट्स भी आप अगर आप टाइम निकालें, आप वीकेंड पर या अदरवाइज इवनिंग में आप किसी स्पोर्ट्स के लिए भी जा सकते हैं। आप कोई जिम ज्वाइन कर सकते हैं, या अगर आपके पास उतना टाइम नहीं है तो जैसे हमने कहा है कि एटलीस्ट आप 30 मिनट निकालिए, आधा घंटा निकालिए और आप अपने फिटनेस पे ध्यान दे सकते हैं। और इसी तरह से आप इस कैंपेन को आप, बिकॉज आप जो हमारे हेल्थ वर्कर्स हैं, हमारे डॉक्टर्स हैं, दे कैटर टू सच ए लार्ज पॉपुलेशन, तो वो जितना स्प्रेड कर सकते हैं। एंड बिकॉज वो जब बोलेंगे तो उनकी बातों को हमारी जो जनमानस है, जो पब्लिक है, वो बहुत सीरियसली लेगा बिकॉज इट इज कमिंग फ्रॉम एक्सपर्ट्स। तो उनका बहुत इम्पोर्टेंट रोल है इस कैंपेन को आगे ले जाने में। एंड देयरफॉर जब मुझे ये अपॉर्चुनिटी मिला तो आई कुड नॉट से नो, बिकॉज आई न्यू कि मतलब इसका बहुत इम्पैक्ट होने वाला है।
यू बिल्कुल आप ठीक कह रहे हैं सर, और आपका बहुत बहुत धन्यवाद कि आपने अपना समय निकाला। एंड सर, यू हैव रियली एनलाइटेंड अस विद योर विजडम एंड विद द efforts which the ministry is doing for the population at large. So we can close the session, sir, and whatever the questions, I think there are many questions and people are very excited to interact with you. So we will be passing these questions to you, sir, and you can give a suitable reply. So
Yes, we would be responding.
yes, sir. So with this, we thank once again Mr. Sandeep Rana and the National Training Division, Shweta Eco, who is the partner of this program, and Swasti Charan sir, DGHS, and the ministry, both the ministries, for organizing this seminar. We hope to meet for the next seminar, which will be on 27th of September, and we will be celebrating the World Heart Day. And I hope we have got 2 weeks in which we should follow the advice of Mr. Sandeep Rana sir and keep our hearts very healthy for the World Heart Day by physical activity. Thank you
Thank
very
you
much.
so much, sir. Thank you, everyone. Thank you.
Thank you. Thank you, sir.
Thank you so much, sir. So, with your permission, Professor Ramesh Agrawal, sir, we can wind up the session.
Yes, please.
Thank you so much, Sandeep, sir. Thank you so much, Dr. Avinash. Thank you so much, Dr. Shweta. And thank you so much, Professor Ramesh Agrawal, once again. And, sir, this was really, really great session. And hoping we will meet once again in the next session in World Heart Day. Thank you, sir.
Thank
Thank
you.
you
Thank you
very
so
much.
much.